Have you ever wondered how to master tough healthcare interview questions? Well, it's all about preparation, understanding the role, and showcasing your skills and experience. Question 1. How would you handle a difficult situation? And could you provide an example of a past situation where you handled such a situation effectively? Here's a suggested answer. Handling difficult situations is an inherent part of healthcare. My approach is rooted in effective communication and empathy. For instance, in a previous role, I encountered a situation where a patient's family was distressed due to a sudden change in the treatment plan. I initiated a private meeting, listened attentively to their concerns, and clearly explained the reasons behind the decision. This approach diffused tension and established a collaborative relationship with the family. Question 2. What do you know about the 6 Cs? A suggested response could be, the 6 Cs are a set of values crucial in healthcare: care, compassion, competence, communication, courage, and commitment. These values guide my approach to providing high-quality care consistently. Scene script. Question 3. What is your protocol for handling an emergency situation? A suggested response might be, in an emergency, quick and effective action is crucial. I would follow established protocols, assess the situation, prioritize patient safety, and ensure clear communication with other healthcare professionals. Staying calm, organized, and focused on the patient's well-being is paramount during emergencies. Question 4. How would you respond to a situation where a patient or a family member was upset or angry about the treatment plan? Here's a possible answer. In such situations, empathy and active listening are key. I would acknowledge their feelings, address the root cause of their distress, provide clear information, and involve them in decision-making. This approach helps to de-escalate the situation and rebuild trust. And finally, question 5. How would you prioritize your workload and responsibilities within this healthcare role? A suggested response could be, effectively managing workload is crucial in healthcare. I prioritize tasks based on urgency and importance, delegate when appropriate, and utilize time management strategies. I'm adaptable and can efficiently handle unexpected changes in a fast-paced healthcare environment. In summary, mastering tough healthcare interview questions involves showcasing your skills, experience, and understanding of the role. Remember, effective communication, empathy, and adaptability are key qualities that healthcare employers look for. And of course, a deep understanding of the 6 Cs and how they guide your practice is invaluable. Keep these points in mind and you'll be well on your way to acing your next healthcare interview. As we wrap up, let's take a moment to consider some of the greatest challenges healthcare is facing both now and in the future. You might be asked about this in an interview, and it's important to have a thoughtful response ready. In my opinion, current and future challenges in healthcare include addressing the growing aging population, managing the impact of technological advancements, ensuring healthcare equity, and navigating complex regulatory changes. It's also crucial to consider the ongoing need for effective pandemic response. This is a challenge that has come to the forefront in recent years and will likely continue to shape the healthcare landscape for years to come. Moreover, adapting to evolving patient needs is another key challenge. As a healthcare professional, staying flexible and responsive to these changes is vital. Remember, these challenges are opportunities for growth and innovation. Showcasing your understanding of these issues and your readiness to tackle them can make you stand out in your healthcare interview. So, keep up to date with the latest trends and challenges in healthcare. It will not only help you in your interviews, but also in your career progression. In preparing for a healthcare interview, one common question you might face is about your greatest strengths. It's important to consider this question in light of the challenges we've just discussed. For instance, you might say, my greatest strengths include a combination of empathy, strong communication skills, adaptability, and a positive attitude. These attributes have allowed me to build effective relationships with patients and colleagues, navigate challenging situations, and contribute to a positive and collaborative healthcare environment. I believe these strengths align with the values and requirements of this healthcare role. This response not only highlights your personal strengths, but also ties them back to the needs of the healthcare industry. When preparing for your interview, consider how your unique strengths can help address the challenges facing healthcare today. Remember, it's not just about stating your strengths, but demonstrating how they can make a difference in real-world situations. So, prepare, practice, and show your potential employer that you're ready to make a positive impact in your role. Let's examine a real-life scenario that showcases the application of exceptional care in a critical situation. Imagine being in a critical care setting where you encounter a patient with complex medical needs. This is a challenging situation that demands a comprehensive understanding of healthcare principles, teamwork, and patient-centered care. In this scenario, you would work closely with a multidisciplinary team to develop an individualized care plan. This plan would address all aspects of the patient's well-being, from physical health to emotional and mental health. This approach is crucial in providing holistic care that treats the patient as a whole, rather than focusing solely on their illness. Through continuous monitoring and timely interventions, you would strive to maintain the patient's health status and prevent any complications. This requires vigilance, quick decision-making, and a deep understanding of the patient's condition and treatment plan. Providing personalized care is another vital aspect of this scenario. This means really getting to know the patient, understanding their needs, and making sure they feel seen, heard, and cared for. Personalized care can significantly improve patient satisfaction and contribute to better health outcomes. At the end of this scenario, your actions would lead to positive outcomes for the patient. This experience would exemplify your commitment to delivering exceptional quality of care in challenging situations. It would also demonstrate your ability to apply the principles and skills we've discussed in a real-world healthcare setting. In your next interview, when asked about a time when you provided exceptional quality of care, you can refer to a similar scenario. By detailing your actions, you can effectively illustrate your understanding of quality care and your ability to implement it in practice. Remember, it's not just about telling what you did, but showing how your actions made a difference. In this next section, we will delve into a principle that is fundamental to all aspects of healthcare: patient confidentiality. This principle requires healthcare professionals to keep all patient information private and confidential. This includes, but is not limited to, medical history, personal details, and other sensitive information obtained during the course of providing care. Imagine this scenario. You are a nurse in a busy hospital ward and you come across a high-profile patient. This patient's case has attracted media attention, and curious colleagues are eager to know more. How do you handle this situation? This is where patient confidentiality comes into play. Despite the curiosity and the buzz, it is your ethical duty to ensure that the patient's information remains secure and confidential. This means not discussing the patient's case or condition with anyone who is not directly involved in their care, including other staff members and media representatives. It also means securing the patient's records and ensuring that they are only accessible to authorized personnel. Upholding patient confidentiality is not just about following rules or avoiding legal issues. It's about building and maintaining trust between healthcare professionals and patients. It's about treating patients with respect and dignity, regardless of their circumstances or the nature of their health conditions. It's about creating a safe space where patients feel comfortable sharing their personal information, knowing that it will be protected. In your next interview, when asked about patient confidentiality, you can refer to this scenario. By detailing your actions, you can effectively illustrate your understanding of patient confidentiality and your commitment to upholding it in your practice. Remember, it's not just about telling what you did, but showing how your actions upheld this vital principle in healthcare. In this section, we'll be discussing the core values that are absolutely essential in the healthcare industry. These values form the very backbone of your profession and guide your actions and decisions, especially in challenging situations. Imagine being asked in an interview, "What values do you think are important when working in healthcare?" This is your opportunity to demonstrate your understanding of the healthcare industry's key values and how you integrate these into your practice. Your answer could go like this. The values crucial in healthcare include empathy, compassion, integrity, respect, and a commitment to patient-centered care. Empathy and compassion help us understand and respond to the needs and concerns of our patients. Integrity ensures that we uphold the highest ethical standards and maintain patient confidentiality. Respect for all individuals, regardless of their circumstances, is vital for promoting a positive and inclusive healthcare environment. Lastly, a commitment to patient-centered care ensures that the patient's needs and preferences are at the forefront of all care decisions. These values not only guide ethical decision-making, but also contribute significantly to the overall well-being of patients. By upholding these values, we can foster trust between healthcare professionals and patients, creating a solid foundation for effective and collaborative care. In your next interview, when asked about your values, you can refer to these principles. By detailing how you embody each value in your practice, you can effectively illustrate your commitment to these core values in healthcare. Remember, it's not just about telling what you believe, but showing how your beliefs influence your actions and contribute to patient care. In this segment, we delve deeper into the practical application of healthcare's core values, focusing on instances where you have provided exceptional care. During interviews or performance reviews, you may be asked to recall a time when you delivered excellent treatment or care. This question aims to reveal your understanding of what constitutes quality care and your initiative in practicing it. For instance, you might recount, "In a previous role, I had a patient with chronic health issues that required long-term management. I developed a comprehensive care plan involving the patient in all decision-making processes and addressing their unique needs. Through regular monitoring, timely adjustments to the treatment plan, and clear communication, we achieved significant improvements in the patient's health. This experience exemplifies my dedication to providing excellent treatment and care tailored to individual patient needs." This answer not only demonstrates your commitment to patient-centered care, but also highlights your ability to adapt and create personalized treatment plans. Remember, it's essential to illustrate your actions rather than just stating them. This way, you can effectively demonstrate your dedication to healthcare's core values in a practical, real-world context. In the next section, we'll explore more about how to navigate common interview questions, so stay tuned. In this scene, we'll be unpacking the concept of safeguarding within the healthcare sector. Safeguarding is a fundamental aspect of healthcare aimed at protecting individuals, especially those considered vulnerable, from harm or abuse. It's about identifying and addressing any concerns related to the safety and well-being of patients, ensuring their rights are upheld, and implementing the necessary measures to prevent or address potential risks. As a healthcare professional, you play a crucial role in safeguarding. This role involves recognizing signs of abuse, reporting concerns, and collaborating with relevant authorities to ensure the safety of those in your care. For instance, in a job interview, you might be asked, "What is safeguarding in healthcare?" A possible response could be, "Safeguarding in healthcare refers to the process of protecting individuals, especially vulnerable populations, from harm or abuse. It involves identifying and responding to concerns about the safety and well-being of patients, ensuring their rights are protected, and taking appropriate measures to prevent or address any potential risks." Healthcare professionals play a vital role in safeguarding by recognizing signs of abuse, reporting concerns, and collaborating with relevant authorities to ensure the safety of those in their care. This response not only shows that you understand the concept of safeguarding, but also demonstrates your commitment to patient safety and well-being. In the next section, we'll be wrapping up, so don't go away. In this scene, we'll focus on the importance of continuous learning in the healthcare sector. As a healthcare professional, you're expected to constantly update your knowledge and skills to deliver the best possible care. This could involve attending workshops, participating in professional development programs, or keeping up to date with the latest medical research. For example, in a job interview, you might be asked, "How do you stay updated in your field?" A potential response could be, "I believe in the importance of continuous learning in healthcare. I regularly attend workshops and seminars and participate in professional development programs. Additionally, I subscribe to several medical journals to stay current with the latest research and advancements in my field. This commitment to learning ensures I can provide the most effective and up-to-date care to my patients." This response not only demonstrates your commitment to continuous learning, but also shows your dedication to providing the best patient care. In the next scene, we'll explore how to demonstrate effective multitasking in healthcare, so stay tuned. In our next scene, we will discuss the significance of adapting communication styles in a healthcare setting. As healthcare professionals, you may encounter patients with different backgrounds, languages, or understanding levels. Being able to adjust your communication style to fit the patient's needs is crucial for effective care. For instance, during a job interview, you might be asked, "Describe a time when you had to use different methods of communication to get your message across to the patient." A suggested response could be, "In a healthcare setting, effective communication is crucial, and adapting my message or style is sometimes necessary. I encountered a situation where a patient had difficulty understanding their treatment plan due to language barriers. I adjusted my communication style by using simpler language, visual aids, and arranging for a translator when needed. This flexibility ensured the patient's understanding and collaboration in their care, highlighting my ability to tailor communication to diverse audiences. This response not only portrays your ability to adapt, but also demonstrates your commitment to patient-centered care. In the next scene, we will discuss demonstrating effective multitasking in healthcare. Stay tuned. In this scene, we will discuss the importance of building effective relationships within healthcare teams. As healthcare professionals, working as part of a team is key to delivering high-quality patient care. However, there may be times when you face challenges in getting along with a team member. For instance, during a job interview, you might be asked, how would you address the situation if you had issues with someone within the healthcare team? A suggested response could be, in a healthcare team, collaboration is key, and building positive relationships is essential. If I were to encounter challenges in getting along with a team member, I would proactively address the issue. This may involve open communication to understand their concerns, finding common ground, and focusing on our shared goals. If necessary, I would seek guidance from a supervisor or engage in team-building activities to foster a harmonious and effective working relationship for the benefit of patient care. This response not only shows your ability to handle interpersonal conflicts professionally, but it also emphasizes your commitment to teamwork and patient care. Stay tuned for the next scene where we will discuss demonstrating effective multitasking in healthcare. In this scene, we will explore how to navigate high-pressure situations in healthcare. As healthcare professionals, you are bound to face challenging situations that demand quick and effective decision-making. For instance, during a job interview, you might be asked, give me a time when you dealt with a high-pressure and challenging situation at work. A good response could be, in a high-pressure situation, such as a sudden influx of patients during a healthcare crisis, I had to manage stress effectively. I prioritized tasks, communicated with the team to distribute responsibilities, and maintained a calm demeanor to reassure both colleagues and patients. Utilizing stress management techniques, such as deep breathing and time management, allowed me to navigate the challenging situation successfully while ensuring the continuity of quality care. This response not only demonstrates your ability to handle pressure, but also highlights your strategic thinking and commitment to patient care. Stay tuned for the next scene where we will discuss demonstrating effective multitasking in healthcare. In this scene, we delve into the importance of teamwork in healthcare, especially when it comes to complex patient care. As healthcare professionals, we often encounter situations that require the collective efforts of a diverse team. For instance, during a job interview, you might be asked, have you ever had to work as part of a team to complete a difficult task? A potential response could be, yes, teamwork is integral to healthcare, and I have experience collaborating with a team to address challenging tasks. In a previous role, we faced a complex patient case that required coordinated efforts from various specialists. I actively participated in team discussions, contributed my expertise, and collaborated with colleagues to develop and implement an effective care plan. This experience highlighted my ability to work collaboratively in challenging situations for the benefit of patient outcomes. This response not only showcases your ability to work as part of a team, but it also highlights your commitment to patient-centered care and your ability to handle complex situations. Stay tuned for the next scene where we will talk about demonstrating effective multitasking in healthcare. In this scene, we will be shedding light on a crucial aspect of healthcare professionalism: clinical governance. Clinical governance is a systematic approach that focuses on maintaining and improving the quality and safety of patient care. It involves a framework of processes, policies, and guidelines that ensure accountability, risk management, and continuous improvement in clinical practice. For instance, during a job interview, you might be asked, what is clinical governance? A well-rounded response could be, clinical governance is a systematic approach within healthcare that aims to maintain and improve the quality of patient care. It's a framework that ensures accountability, risk management, and continuous improvement in clinical practice. It promotes evidence-based practice, monitors performance, and fosters a culture of quality and safety within healthcare organizations. This response not only demonstrates your understanding of clinical governance, but also underlines your commitment to quality patient care. Stay tuned for the next scene where we will discuss demonstrating effective multitasking in healthcare. In this scene, we'll discuss a critical aspect of healthcare professionalism: stress management. As healthcare professionals, we often find ourselves in high-stress situations due to the nature of our work. It's vital to have effective strategies in place to manage this stress, ensuring that it doesn't negatively impact our performance or the quality of care we provide. For example, during an interview, you might be asked, "How will you deal with the stress that often arises in healthcare?" An appropriate response could be, "I recognize that stress is inherent in healthcare, and I have developed effective strategies to manage it." Regular self-care, including exercise, mindfulness, and maintaining a healthy work-life balance, is crucial. Additionally, I prioritize clear communication within the team to share the workload and support each other during challenging times. Seeking guidance from mentors, utilizing available resources, and maintaining a positive outlook are essential components of my stress management approach in the healthcare field. This response not only demonstrates your understanding of the stressful nature of healthcare, but also shows your proactive approach in managing it. Stay tuned for the next scene where we will discuss demonstrating effective multitasking in healthcare. In this scene, we'll explore the essential role of patient advocacy in healthcare and how to handle situations of inappropriate treatment. As healthcare professionals, we are not only care providers, but also advocates for our patients' rights, safety, and well-being. For example, during an interview, you might be asked, "If you witnessed another healthcare professional treating a patient badly, what would you do?" An appropriate response could be, "Patient advocacy is a fundamental responsibility in healthcare, and witnessing inappropriate treatment demands immediate action. I would address the situation promptly by intervening to ensure the patient's well-being and safety. Simultaneously, I would report the incident to the appropriate supervisor or authority within the organization. Upholding ethical standards and advocating for patients is paramount in maintaining the integrity of the healthcare profession." This response not only demonstrates your commitment to patient care, but also shows your understanding of the ethical responsibilities in healthcare. Stay tuned for the next scene where we will discuss demonstrating effective multitasking in healthcare. In this scene, we will address the challenging scenario of dealing with an aggressive patient in a healthcare setting. As healthcare professionals, we may encounter patients who, due to pain, fear, or other factors, may exhibit aggressive behavior. It's crucial to handle these situations with a calm, measured approach. For example, during an interview, you might be asked, "Tell me how you would deal with an aggressive patient." An appropriate response could be, "Dealing with an aggressive patient requires a calm and measured approach. I would prioritize the safety of both the patient and myself. I would attempt to de-escalate the situation by maintaining a non-confrontational posture, speaking in a calm tone, and actively listening to the patient's concerns. If necessary, I would seek assistance from security or other healthcare professionals trained in managing aggressive behavior. Ensuring a safe environment for everyone involved is the primary goal." This response shows your ability to maintain professionalism in high-stress situations while prioritizing safety. Stay tuned for the next scene where we will discuss demonstrating effective multitasking in healthcare. In this scene, we will discuss the importance of having a clear vision for your healthcare career. It's common in job interviews to be asked about your future plans. For instance, where do you see yourself in 5 years' time? This question gives you the opportunity to showcase your career aspirations and commitment to the healthcare field. An ideal response could be, "In 5 years, I envision myself furthering my career within the healthcare field. I am committed to continuous learning and professional development, aiming to take on roles that allow me to contribute to the improvement of patient care and healthcare systems." This response demonstrates your long-term commitment to the healthcare field, your eagerness for continuous learning, and your ambition to make a positive impact. Stay tuned for the next scene where we delve into the challenging, yet crucial aspect of multitasking in a healthcare setting. In this scene, we'll delve into the challenging, yet crucial aspect of multitasking in a healthcare setting. As healthcare professionals, you're often required to juggle multiple tasks simultaneously. This could range from patient care, coordinating with various departments, to handling administrative responsibilities. For instance, during a job interview, you might be asked, "Describe a time when you had to manage several different tasks at the same time." A possible response could be, In a fast-paced healthcare environment, managing multiple tasks simultaneously is a common challenge. During a particularly busy shift, I had to prioritize patient care, coordinate with various departments, and handle administrative responsibilities. I effectively utilized organizational tools, delegated tasks when appropriate, and maintained clear communication with the team. This experience showcased my ability to multitask efficiently while ensuring the quality and safety of patient care. This response not only demonstrates your capability to handle multiple responsibilities, but also highlights your prioritization skills and commitment to patient care. Stay tuned for the final scene where we wrap up our discussion on key aspects of healthcare professionalism.